My name is Jessica, and I am a nurse practitioner student with Auburn University. Today I'm going to talk to you about viral upper respiratory infections. A viral upper respiratory infection is a contagious infection of your upper respiratory tract. This includes your nose, your throat, your pharynx, your larynx, and your bronchi. It is very common in the months of September to March. Adults and children alike get it. Adults tend to get it 2 to 4 times a year. The symptoms peak at 1 to 3 days after exposure and can last for 2 weeks. Those who are at risk for this diagnosis are those who work in hospitals or in schools, crowded conditions like daycares, if you're next to somebody who has a URI, if you're immunocompromised. Smoking and stress also increases your risk of obtaining a URI. So you have a patient that comes in, just complains of general malaise, headaches, tiredness, they've got some congestion. What are 3 questions that are important to ask to diagnose them with a URI? One question is, do you have nasal congestion? Do you have stuffiness? 80 to 100% of URIs is going to present with nasal congestion. The drainage can be clear, yellow, and even green. Another question is, let's look at their throat. Do you have a scratchy throat? Do you have a sore throat? You want to look at it, make sure it's nothing like an epiglottis. And you're going to have redness. You may have some pustulars. You're going to have some postnasal drip on it. Your mucosa is going to be red. Another question to ask is, have you been running a fever? We want to know, is it low-grade fever, which is a symptom of a URI, or is it something higher, that something more could be going on with? You expect them to have a low-grade fever when they come in. So your physical assessment, you want to do their vital signs. They may be tachycardic because of the low-grade fever. You're going to look into their nose. You're going to have edema. You're going to have some drainage. Their throat, postnasal drip. You're going to have some redness. Those are some of the top diagnoses, physical exam that you want to do. Listen to their lungs. Make sure there's no wheezing or you don't hear any, like something that could indicate pneumonia. So once you do that, there really is no diagnostic test. If you do suspect strep throat, you can do a strep test. If you expect, think about the flu because of the fever, you can do an influenza. And then, of course, if it persists and the fever persists, you can always come back and do blood work for a CBC to kind of distinguish between a viral and a bacterial infection. So some of the common treatments, we're going to do just symptom management. You're not going to do antibiotic for this. You're going to do saline nasal irrigation, zinc longes, especially every 3 hours, like the first 24 hours. You're going to do Tylenol and NSAIDs for their fever, their pain. You can also do some over-the-counter oral decongestants. Be careful with older people though, because they tend to have more side effects. So the teaching that you really want to do is, number 1, of course, hand washing. Hand washing to prevent a reinfection because they can be re-exposed. Hand washing to prevent spreading the URI. Also, you want to teach about the difference between a bacterial and a viral infection because a lot of people come in, they want antibiotics. So you want to tell them why an antibiotic would not work. The other teaching thing is you want to tell them drink plenty of fluids, get some rest, stop smoking for these, hopefully ever, but at least for these few days. And it can, a lot of people are out of work. A lot of people feel really bad. So you really want to teach them to rest, drink fluids, wash their hands, teach them about symptom management. And always they can come back if their fever and their symptoms persist or they become short of breath, anything like that. So thank you, and hopefully you won't get a URI.